Hi, my name is Crystal Briss, and this is my head to toe assessment video for Nursing 111. I'm going to do an environmental scan. So first, I'm going to knock. When I enter the room, I'm going to introduce myself. Hi, my name is Crystal. I'm going to be your nursing student. I'm going to explain the procedure. I'm going to be doing a head-to-toe assessment. I'm going to go through each one of your body systems. If you have any questions, let me know, and I will explain any as best as I can. So I've gathered my equipment. I have my stethoscope, my pen light, some alcohol wipes, some hand sanitizer to do hand hygiene. Would you like me to close the curtain for privacy?
No.
Okay. Can you tell me your name and date of birth?
Brandy 01/04/2003.
And I'm going to check that against her bracelet and the electronic health record. So I know she's alert and oriented to herself. Can you tell me what day it is?
November 25th.
And where are we?
Flushers.
And what are we doing?
A head-to-toe assessment.
So she is alert and oriented ×4. She has a pleasant mood. Her affect is normal, and she's not having any behaviors. So usually I would do your vital signs, but I'm just going to explain them to you. So your blood pressure, the top number is your systolic blood pressure, and that should be between 95 and 140. The bottom number is your diastolic blood pressure, and that should be between 60 and 90. Your heart rate, or your pulses, I would be assessing the rate, the rhythm, and the amplitude. The rate should be between 60 and 100 beats per minute. The rhythm should be regular. The amplitude would be 0 to 4. 0 would be no pulse at all or absent, and 4 would be bounding or like your heart's beating out of your chest. And so we want it to be at 2. I'm going to assess your carotid artery, your radial pulse. If I was assessing her femoral artery, I would assess it right here. And then your posterior tibial pulse and your pedal pulse. When I'm looking at her pulses, I'm going to be checking to make sure that they are equal on both sides, that they are +2 or hopefully +2, and that they are between 60 and 100 beats per minute. So for your temperature, should be between 97 and 99. Anything 100.5 or greater would be a fever. For your respirations, it should be between 12 and 20. I'm looking at the rate, the rhythm, and the depth. The rhythm should be regular and equal on both sides, and the depth should be not too shallow and not too deep. For your O2 sat, it should be greater than 95%, and if you were on any oxygen, I would want to know how many liters you were on, and what kind of device you were using. And so for your pain, I'm going to use a 0 to 10 scale, 0 being no pain, 10 being the worst pain you've ever felt. So are you having any pain?
No.
So if she had said yes, I would use the Coulter method to assess the characteristic, the onset, the location, the duration, exacerbation, the relief, or radiation. So for her skin, I would be assessing that throughout the entire assessment. I'm looking at the color, the temperature, or if there's any moisture. I would want to note if there was any lesions, bruises, rashes, wounds or edema. And then if she has any IVs or drains, I would want to check them for patency and check the site. And then for if she had any ostomies or if she had any catheters. So for the braiding scale, that it should be between 6 and 23. Anything 18 or below would indicate that she would be at risk for pressure ulcers. So then for her head, we want to make sure that her hair is evenly distributed. I would want to check behind her ears, make sure there's no skin breakdown. For her eyes, I'm looking that they're opening and closing the same on each side and that everything is symmetrical. I'm going to assess her pupils using the Perla method. I'm looking that her pupils are equal, round, reactive to light and accommodation. And then after that, I'm going to use the STAR method to assess her 3rd, 4th, and 6th cranial nerve. Her 3rd is the ocular motor, 4th is the trochlear, and 6th is the abducens. So can you put your hand over your eye? Okay. Okay. And they are 3 millimeters on both sides. They're equal. They react to light. They're round. And so I want you to hold your head still and follow this with your eyes. Okay, keep following it. Okay, and so they react to accommodation. Do you wear any kind of contact lens or glasses?
No.
Do you have any trouble seeing me?
No.
And do you have any trouble hearing me?
No.
Do you use any kind of hearing aids?
No.
Okay. So for her nose, I'm going to assess her nares and check for patency. So I'm going to put my finger on one side of your nose and I want you to breathe out and let me know if you have any trouble breathing, and then we'll do the other side. Okay? Okay. And so she doesn't, and so, can you close your eyes? All right, so tell me what you smell. Okay.
Alcohol white.
All right, so that is to assess her 1st cranial nerve, her olfactory nerve. I'm going to touch the side of her face, and that is to assess her 7th cranial nerve, her facial nerve, and I'm looking for any kind of twitching or irregular movements. So for her mouth, I'm looking at her lips, her mucous membranes, making sure that they're pink and moist, her teeth, making sure that they're intact and nothing's broken, looking for any kind of sores and lesions. And then I'm going to have you say ah, and I'm looking for her palate that it rises equally on both sides, and that is to assess her 9th cranial nerve, the glossopharyngeal, and if I was going to assess her 10th cranial nerve, the vagal nerve, I could use a tongue depressor and cause a gag reflex, but I'm not going to do that, so can you say ah? Okay. For your 11th cranial nerve, I'm going to have you push against my hand with your head. Okay. Okay. And now with your shoulders, I want you to shrug your shoulders and push against my hands. Okay. So her 11th cranial nerve is intact. So, and for range of motion, I want you to go like this. Okay. And then, so she's sitting at a 45-degree angle, and I can assess her jugular vein for distension. It's not distended, so next I'm going to palpate and auscultate her carotid arteries one at a time so that I don't disrupt any blood flow to her brain. So they should be between 60 and 100 beats per minute. And when I'm auscultating, I want to make sure when I'm palpating them that they're equal on both sides. When I'm auscultating them, I'm listening. A normal finding would be either hearing nothing at all or S1 and S2. What I don't want to hear is any kind of swishing or breathing sounds. So I'm going to auscultate with the bell of my stethoscope. Okay. All right. So then I'm going to move down to her upper extremities. So the first thing that I'm going to do is her hand grasp. I want you to squeeze my hands on each side. Okay, good job. And then I'm going to check for capillary refill, and it should be less than 3 seconds. Okay. Then I'm going to check her pulses and make sure that they're equal on both sides, that they're 2+, and that they're within 60 and 100 beats per minute. Okay. And then I'm going to have you close your eyes, and I want you to tell me where I'm touching.
Lower arm.
Okay.
Upper arm.
Okay. And then for your range of motion, I want you to go like this, your shoulders, and then with your elbows, and then with your wrists. Okay. So for her abdomen, or for her chest, first I'm going to assess her lung sounds. I'm listening for, I want to hear that there's air moving in all 5 lobes. I do not want to hear any kind of wheezes, rales, rhonchi, or stridor. So I'm just going to demonstrate where I would do this at, and I would tell her each time to take a deep breath. Okay, so I would do here, 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 on her side, and then on this side, and then can you sit up? Here, 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 and here. Okay? And so you can sit back now. So then I would listen to her, I'm going to listen to her heart sounds. I'm going to start with her aortic valve at her second intercostal space right sternal border. And S2 should be louder than S1. Then I'm going to move to her pulmonic valve at the second intercostal space left sternal border, and S2 should be louder than S1. Then I'm going to move to Erb's point at the third intercostal space left sternal border, and S1 and S2 should be equal. Then at her fourth intercostal space left sternal border, I'm going to listen to her tricuspid valve, and S1 should be louder than S2. And then her fifth intercostal space mid-subclavicular line is her mitral valve, and S1 should be louder than S2. And I'm also going to palpate that area because that's the point of maximum impulse. So okay. And then I could also listen, I would also want to listen, and if I heard any kind of extra sounds like S3 or S4, I would want to note that. So for her abdomen, I would want to inspect first, then auscultate, and then if I was going to percuss, I could percuss her liver and her spleen for enlargement, but I'm not going to do that, and then palpate last, so that I don't disrupt any of her vowel sounds. So when I'm listening, I'm going to start with her right lower quadrant. I'm going to listen for at least 1 minute, and if I don't hear anything, I'm going to listen for up to 5 minutes before I can say that it is absent. Then I'm going to move to her right upper quadrant, then to her left upper quadrant, then to her left lower quadrant. Okay, so have you had a bowel movement, or when was your last bowel movement?
Today, this morning.
And do you have any issues with incontinence or urinary retention?
No.
Okay. And then I also would want to note that her chest, her AP diameter is twice as wide as it is deep. So then moving down to your legs, first I want you to close your eyes and tell me where I'm touching.
My thighs.
Okay.
My calves.
Okay. And then I want you to lift your leg against my, okay? Okay. Then I'm going to check her pulses and make sure that they're equal on both sides. Her pedal pulse should be 2/3 way up her foot. And then her posterior tibial pulse is on the inner aspect at the back of her ankle. And I'm going to check to make sure that they are equal on both sides, that they're +2 in amplitude, and that they are within 60 and 100 beats per minute. And so then I would check her toes for capillary refill. Okay, so I'm going to have you stand up. For range of motion, to check your hip, your knee, and your ankle, I want you to lift your leg, turn your ankle, and then pull your leg back. Okay, now do the other one. Okay. So that concludes my head to toe video assessment. Thank you.